WAJR and the AJR News Network welcome you to Wellness Wednesday, North Central West Virginia's premier medical talk show, presented by Fairmont Regional Medical Center, the only hospital in West Virginia to be recognized 4 years in a row as a top performer by the Joint Commission. Now, here's your host for Wellness Wednesday, Kyle Wiggs.
Kyle Wiggs is finishing up with the West Virginia Black Bears, celebrating their championship in the New York Penn League. So Dave Wilson filling in for Kyle Wiggs this morning, sitting in the big chair. And joining me from Fairmont Regional Medical Center is Jeremy Larew, a certified physician's assistant. He is in the studio with me this morning. We're going to be talking about the Wound Center at Fairmont Regional Medical Center, its services, how it operates, and the fact that it's still there. Some people forget that from time to time. We'll get into all of that, but first, let me once again reintroduce Jeremy Larew. Did I get the title right? Certified Physician's Assistant?
Yes, sir. Thanks for having me.
I mess those up sometimes. It happens
Easy
occasionally. Well, Jeremy, tell me, first of all, a little bit about yourself. Where are you from? How did you get to Fairmont Regional Medical Center?
I'm from local here, Preston County. Grew up in Fellows,ville. Went to West Virginia University and obtained an undergraduate degree in biology, and then went on to PA school at Alderson Broaddus. Since that time, I've worked mainly internal medicine at Mon General Hospital, and got into the wound care arena back in 2011. And from there, spun off and have been providing coverage down at Fairmont Regional for the past 6 to 8 months.
What got you interested in the medical field?
Probably a personal injury of my own that led me through a complicated path that opened my eyes to the, I guess you would say, the rewarding side of medicine, and that led me there.
You hear that a lot from doctors. A friend of mine who tore his knee up playing football in high school he's an orthopedic surgeon now, and a big reason for that was, I guess, meeting the surgeons and the people he worked with when he got his knee fixed. That was a big push.
Yeah, I hear that myself a lot.
So the Wound Center at Fairmont Regional Medical Center, first of all, a lot of changes over the last year, 18 months at the hospital, but it is still there and a very vital part of the operation.
Yeah, actually, in fact, we've only seen progress, especially in the last 12 months. The volume has increased, the service lines have increased. Really, the community has stood behind this hospital, and we've made great progress in the last year especially.
So what is the purpose, what is the goal of the Wound Center at Fairmont Regional Medical Center?
I would say the primary goal is to keep the patients in the community whenever possible. So many patients are in the habit now of traveling 30 minutes, 60 minutes to get to an appointment, and it takes a half a day by the time they drive an hour each way and sit in the office for half the afternoon. So if you can keep the care local and you can provide good quality care to the community, that would be the goal.
Is this a unique service in the region?
I would say it's not. Each county probably has one center. Some counties do not have any at all. So, for example, Taylor County or Preston County would refer patients, but Mon County and Marion County, Harrison County have centers. But what is kind of unique is we do have a full-fledged hyperbaric oxygen therapy, which not all centers operate at this point.
Okay. You're going to have to explain what is a hyperbaric. Explain that one to me.
Okay.
What is that, and what is its purpose?
Hyperbaric oxygen is a type of therapy that's more advanced. We use it for more complex wounds, wounds that involve the bone, maybe wounds that are infected in a certain way, wounds that are arterial in nature, certain types of wounds that develop as a sequelae or result of cancer can be treated in the hyperbaric oxygen chamber. The way it works is you put the patient in the glass plexitube type chamber. It's sealed behind them. They stay in there for 90 minutes. There is high flow oxygen pumped into the chamber under high pressure, which increases the oxygen concentration in the bloodstream. We know that oxygen is what heals the wounds by bringing oxygen to the tissue. That's the basic principle of the chamber, and it's quite effective.
And this is unique. Is this one of the only centers you said in the region is at Fairmont Regional Medical Center?
Yeah, there is probably 10 in the state of West Virginia, if I had to guess off the top of my head, that's functioning with a hyperbaric therapy.
We're talking with Jeremy Larew, physician's assistant, certified physician's assistant at Fairmont Regional Medical Center, focusing on the purpose and the goals there of the Wound Center at Fairmont Regional Medical Center. When we return, exactly what kind of patients do you see and what kind of wounds do you treat? I think we have a stereotype when we hear a wound of what that is, but that covers a very broad array of subjects. We'll continue next with Jeremy Larew here on Wellness Wednesday.
Now back to Wellness Wednesday, presented by Fairmont Regional Medical Center on WAJR and the AJR News Network.
Dave Wilson filling in for Kyle Wiggs today. Jeremy Larew is my guest, physician's assistant with Fairmont Regional Medical Center. We're talking about the Wound Center at Fairmont Regional Medical Center. And Jeremy, before the break, was talking about the Wound Center. And maybe it's because I spend most of my day in the newsroom, but when I hear wound, I'm thinking a traumatic injury, a knife wound,
Right.
for example,
Right.
Or maybe even a sports injury, but something along those lines. But that is just one small aspect that you can treat at the Wound Center.
And that's absolutely correct. We see a wide variety of wounds. I would say most commonly we're dealing with venous wounds coming from incompetent veins. We do a lot of diabetic wounds, feet wounds. We have infected wounds that have been chronic in nature. I would say the specialty of the clinic is the fact that we do take the most complicated and the most chronic wounds that don't heal on their own. You know, if you scrape yourself or you get a cut or this or that, normal healthy people will just heal themselves as long as they don't get infected. But it's after about 4 weeks, if your wound hasn't closed especially, you really want to consider higher level care, specialty care for the wound. Now granted, we would be happy to see any wound, but the specialty comes from the chronic wounds for sure.
My wife's grandparents, who are now in their mid and late 90s, actually, we were sitting around having dinner one day, and her grandmother says, "Well, I got to go to the Wound Center tomorrow." And you kind of take pause and you go, "Wait, you're 94. Why are you going?" She bumped her leg on the coffee table.
Right.
And, okay, again, like you point out, you or I bump our leg. We might get a bruise. We'll probably curse the coffee table.
Right.
But for her, it was a scrape that bled and wouldn't seal itself.
Never stopped bleeding.
Right.
A lot of these patients are on blood thinners, anticoagulation. These patients have poor nutrition. Sometimes their protein stores in their body are low, which also is a major contributing factor. Elderly people also sometimes don't have the social support or the resources that they need to do simple things like offloading or simple dressing changes. I think that's really where our center excels also, is the fact that we have a very highly trained and talented group of people working alongside of the physicians to provide the best care on a daily basis. I can't say enough about the staff.
That was, I hate to keep using my wife's grandparents, but they're a great example. You talk about dressing, properly, keeping the bandages clean and wrapped.
Right.
That can be a chore, especially, let's say, if you have a little trouble seeing.
Right.
as they do.
Right. Like you said, these things all compound to have a devastating effect on some of these patients. And again, that's why I have patients who would come into the center that's had an open wound for 3 years or 4 years. And, you're always at risk and vulnerable for infection and further complications the longer the wound remains open. So again, seeking out attention sooner rather than later would be advisable.
And that was actually going to be my next question. Some of us, us guys, when, we trip and fall and something gets busted and it'll be fine, it'll heal itself.
Right.
But the longer you let something fester, what are the risks associated with not getting something checked out and fixed?
We know that the wounds go through multiple phases. There's an acute phase reaction, there's chronic phases. Wounds that go into a chronic stagnant type phase are much more difficult to heal for many reasons. I would say that's the biggest issue. Second of all, you always have, again, a risk of infection. The skin, you have to remember, is a barrier to prevent infection to the body. It's your first line of defense. Once that skin is opened or broken, you're susceptible and vulnerable to infection. And the infection can be superficial, like a cellulitis, or it could go deeper into the bone. Tracking back to what we talked about, the hyperbaric therapy, you don't see a wound come in that's been there for a month that's going to need hyperbaric oxygen. It's those wounds that get procrastinated and left aside that we end up having a lot of problems with.
Do I need to be referred to the wound center, or can I make an appointment and come in to have a wound or an ailment checked?
Yeah, that's actually the nice part. A lot of specialties require referral. This wound center does not require any type of referral. Any patient can just simply call in, make an appointment to be seen, and go from there. Sometimes it's a simple 2-3 times they need to be seen. Sometimes these patients are in therapy for 6 months or a year. So just depends patient to patient.
I'll put you on the spot here, and you can ballpark it. How many patients are you treating in general?
At the clinic in total, or myself?
At the wound center.
In total, there's about 65 active patients that are being seen there currently. Before some of the restructuring, the community had the needs, and they were somewhere near 100. So that's a little bit of a change, but truthfully, the quality and the availability is still there and active in Fairmont.
And for whatever reason, there's a stigma with people. Well, I want to go to Pittsburgh. I want to go to Columbus.
Right.
Or I want to go over to Baltimore.
Yeah, you hear that.
But this is a high-quality center in Fairmont, right here locally.
And I can tell you that that's true because, and not uncommonly, just last week, University of Pittsburgh Medical Center referred a patient back to us who lived in the Fairmont community. So that just tells you that if the larger centers are referring backwards, they have the trust in the quality and the outcomes of this facility. And I think it'll speak for itself, truthfully.
We're talking with Jeremy Larew. We're talking about the Wound Center at Fairmont Regional Medical Center. Still more to come here on Wellness Wednesday.
We're talking about your health with the professionals from Fairmont Regional Medical Center on WAJR and the AJR News Network.
Jeremy Larew is my guest this morning, physician's assistant at the Fairmont Regional Medical Center. More specifically, works at the Wound Center at Fairmont Regional Medical Center. Jeremy, what is Doppler evaluation as it pertains to the Wound Center?
The Doppler evaluation is a way we can try to evaluate maybe where the wound is coming from, especially in the case of a patient who doesn't know how the wound started or when. And sometimes even if they do know, these things can just start out spontaneously overnight and they wake up with a big problem. The purpose of the ultrasound is to determine the flow of both the venous and the arterial flow to determine what treatment should be rendered in these patients. And a lot of times it's overlooked as a cause of the wound, but I would say it's running somewhere in the range of 40% of all the wounds we see is as a result of this.
Can you do skin grafts at the Wound Center? Is that part of the overall aspect of it?
Yeah, absolutely. We have multiple different types of skin grafts. Depending upon the patient's need, we can actually skin graft them right there in the clinic. One of the differences is we don't use an autograft, which is where you take the patient's own skin, which creates a second wound, and those are occasionally needed. But for the majority of the wounds we're dealing with, we can use a donor graft. And that's much better for the patient. It's less pain, it's a quicker recovery, and it works very well.
What kind of patients do you see burn patients needing those? I guess that's the first that comes to mind when you're talking about grafts.
We definitely see a fair amount of burn patients, and burn patients can definitely benefit from grafts. However, one graft in specific that we use is able to be used across the board for diabetic wounds, venous wounds, trauma wounds, burn wounds. So it's not limited, but in fact, it's definitely one area that you would see it used a fair bit.
We talked a lot about the services of the Wound Center this morning. And again, I go back to my wife's grandparents. They're my example for everything. But when they go to the doctor, when they come back, the last thing they talk about is the services. The first thing they talk about was how nice so-and-so was,
right.
How well so-and-so explained what was going on.
Right.
It's really the staff that makes the Wound Center what it is.
And again, that's the highlight of this Wound Center. If you had to say what differentiates this, yes, we have every service line that I can imagine that you would want in a wound center, but the people is what truly stand out. We have people that have worked there for more than 15 years. Some of them have devoted their entire careers to treating nothing but wounds. Most of them live right in the Fairmont area, and they're local. They know a lot of the people when they come in. Some of the people have to come back multiple occasions for different issues, and it really gives them a sense of comfort when they see how connected the staff is and concerned about their problems.
You get on a first-name basis. You build that trust with the patient, and that's important.
Right, and this is a little bit of a different setup than most patients are used to. Most patients see their general physician every 6 months or every 3 months. They go into a specialist office every 3 months. When you have a wound, it's important to have continuity and consistency, and we tend tend to see the wounds on a weekly basis. We found that allows the wound to heal much faster and without further complications. People say, well, do I really need to come every week? We do that on a case-by-case basis, but most of the people do. But circling back to your point, you do get on a first-name basis because you develop a true relationship with the patients that you're seeing so frequently.
Yeah, you get on a first name and then you keep showing up long enough. That guy knows what he's talking about. That guy doesn't know what he's talking about.
Right.
I've got the full rundown from my, my grandparents there. Hey, what are the hours of the clinic, and how can we get in touch?
Like I said, you don't need a referral. The patients can call directly if they have any issues or if they want to be seen for any reason. They call the wound center directly. The hours of operation are Monday through Friday, 8 a.m. to 4:30 p.m. We have a very dedicated staff. You can usually be seen within 24 hours, almost always. So it's getting in is not much of an issue. We remain immediately available to these patients' needs.
And the phone number to the Wound Center, by the way, 304-363-4698. Hours 8 to 4:30 Monday through Friday. So your standard business hours is when you need to get in touch.
Right. That's absolutely correct.
Talking with Jeremy Larew. We're talking about the Wound Center at Fairmont Regional Medical Center. And to go back to our opening point, these services are local. These are local staff that are helping you. You're going to get to know them on a first-name basis. Again, it's one of those things that's unique that, yeah, you can get this service somewhere else, but this is 10 minutes down the road, 10 minutes from anywhere, really, down the road. You don't have to go to Pittsburgh, Columbus, or over toward the Panhandle in Baltimore to get these good services.
Right. And, a lot of general physicians will refer their patients after they've treated them for a few weeks and they see that they're not making any progress. What people have to realize is we have a lot more tools in our tool belt when it comes to treatment options. We have a lot of advanced wound care dressings that aren't widely known to the general public or the physicians. We have a lot of advanced diagnostic tools that we use, and we have a full treatment algorithm. Every person's put on a care plan. We evaluate that aggressively, and we do ensure that they're moving along with progress.
Are patients surprised by all of that advanced treatment? Because you get an old-timer, or me, who doesn't have any idea what goes on there, really, and you think, oh, great, I'm going to the wound center to get a fancy Band-Aid. It is so much more than that.
That's absolutely right. We have a conundrum in wound care. We have wet wounds you want to make dry wounds you want to make wet. It's the old adage that you can't make anyone happy, and that's how a wound is. So you need to be picking the right products, and you need someone with the experience and the expertise to realize, is the wound too exudative, too wet, is it too dry, and what products are available for these people. And again, when specialized care is needed, it's right in the backyard for these folks.
At Fairmont Regional Medical Center, again, the hours 8 to 4:30, Monday through Friday. You can call them at 363-4698. You got into medicine. Is it fulfilling?
Absolutely.
What's your favorite part?
Wouldn't change anything. I really like getting to know the patients and developing that relationship. I mean, it's great if you can provide a service to somebody. A lot of times you don't develop that connection or that relationship. But I would say out of all the places I've worked, the Wound Center allows for that due to the fact that you're seeing them at a high frequency and you're seeing rapid results. And it's very fulfilling to see someone have a pretty large problem, walk away in 3 months with no issue. And they're very grateful, and that's satisfying.
How many patients do you individually handle?
In a clinic, we might see 15, 20 patients in a clinic.
So you really get to know people on a personal basis.
Oh,
there,
absolutely.
Don't you?
I would say on average 15 would be the number, but that allows over 4 hours. You have 15, 20 minutes to spend with the patients, and that gives you that personal time that the patients need, especially in this setting.
You ever get a Christmas card? My grandmother's always classic for sending doctors and nurses Christmas cards.
I get a lot of cards, but I get a lot of food, and I never turn it down.
Absolutely not. Never turn that down. Fairmont Regional Medical Center, the Wound Center there, again, 8 to 4:30, Monday through Friday, 363-4698. Jeremy Larew, a physician's assistant, thank you for coming in this morning and
Thanks for having me.
it a little bit more thoroughly.
Yeah, absolutely. Thank you, guys.
Coming up next, Fox News and your local news. This has been Wellness Wednesday right here on WAJR and on the AJR News Network.